Today there is one new case of COVID-19 who was in managed isolation in New Zealand. It's been 74 days since the last case of COVID-19 was acquired locally from an unknown source. Today's new case is a woman in her 60s who arrived in New Zealand on the 30th of June from Pakistan and had travelled via Doha and Sydney. She's been in managed isolation at the Novotel in Christchurch and tested negative on her first test, her day 3 test, and then tested positive on her day 12 test. So I do want to reiterate again, this is the reason why we do testing over a period of time, why we're testing people near to their arrival and near to their departure. That aligns with the incubation period for the virus. It means that we can be certain that nobody is being released until they have they've been cleared of COVID-19. So the second test around day 12 is important because of the period of time it can take for some people to incubate the virus and to test positive. So that brings our total number of confirmed cases to 1,195, which is what gets reported to the World Health Organization. One previously reported case is reported to have now recovered, which means our overall numbers of current positives remains the same at 25. There is nobody receiving hospital level care here in New Zealand as of today. I will just check the second page. I'll keep this brief. 1,620 tests were conducted yesterday, which brings the total number of tests completed to 431,263. I've mentioned before the importance of people downloading the COVID Tracer app. Dr. Bloomfeld mentioned that in his briefings yesterday as well, and I do want to reiterate again to New Zealanders, it is important that we all play our part by preparing for any future need to contact trace, and we can all do that by downloading the app, by using the app, and by keeping a record. The latest update to the app will be out in a couple of weeks. That will allow people to manually enter in additional appointments where QR codes might not be present, like when they're visiting friends, family and relatives and so on. And I've also checked, based on a question from your colleagues in Wellington yesterday, that the ability to add appointments or add contacts retrospectively will also be included in that as well. So if you forget to scan somewhere, you remember afterwards and you want to add it retrospectively, you'll be able to do that as well. So that functionality will all be included in the next update of the app, which will be released. Just one final message on testing. As I've mentioned earlier, or actually mentioned last week, the government is concerned about the overall downward trend in the rate of testing. I've been working with the Ministry of Health on a new strategy around that to make sure that we're getting those testing numbers back up again. They'll be issuing further guidance to general practitioners and to others later on today, by the end of today, to ensure that we are increasing our overall testing rates. They are certainly aware of the fact that the current rate of testing isn't where it needs to be. We have gone back and checked though, and as well as testing numbers going down on the weekend, we've also seen evidence that testing numbers go down during the school holidays as well. And so we are, of course, in the middle of the second week of the school holidays. But we do want to see the overall rate of testing going back up again, and health officials will be working by the end of the day to issue revised guidance so that those testing numbers can come back up again.